Hello and welcome to Let's Collaborate, a podcast from the Southwest Doctoral Training Partnership. I'm your host, Chris Garrington, and joining me for this episode, recorded at the Collaboration and Connectivity Conference, is Flo Avery, who's researching the impact of childhood trauma on long-term health outcomes, and she's based at the University of Swansea. So welcome, Flo. And I wonder if you can just start by talking us through a little bit about your research.
Yes, thank you for having me. So what I'm looking at is it's been established since about sort of the early 90s that certain experiences that occur before the age of 18, traumatic experience like experiences of abuse or growing up in a home where there's alcohol abuse or substance abuse, can have a really long-term impact on not only mental health but physical health. So if you have a number of these experiences, often known as adverse childhood experiences or ACEs, if you have a number of ACEs, that makes it more likely that you may struggle with your mental health, but also that you will develop diabetes later in life or that hypertension. So it's linked to a really wide range of health outcomes. And what I'm looking at is what kind of ACEs and how common ACEs are in Wales, and looking at what interventions might potentially help to mitigate the negative impact of these.
Fantastic. More of that a little bit later. So tell us a bit about how you're going about that. I mean, what are you doing exactly?
Yes. So a large part of my PhD is the idea of co-production. So the PhD is actually part funded by Public Health Wales, and they're very keen to ensure that young people's voices are heard throughout this research process. So initially what I'm doing is a all Wales survey on ACEs, so looking at trying to hear from as many 16, 17, 18-year-olds across Wales as possible as to what ACEs have been experienced, and also what helped or what would have helped with dealing with those experiences. Going from that, we'll be working alongside young people, involving them in the research and really getting their perspectives and what sorts of interventions they think would be helpful, and then potentially moving on to piloting those interventions. So we've got a really strong evidence base for interventions that can be used in education or healthcare, different public bodies to support this.
Fantastic. And I wonder, PhDs are usually, come in mind with, coming up with something original, if you like. So what new insights will your PhD provide, and how do you hope those insights will benefit people, and particularly those children who either will sadly experience childhood trauma, will go through a bad thing in their childhood, or in order to prevent those things, presumably, as well?
Yes. So adverse childhood experiences have been studied before in Wales, but not, I think it was 2015 was a report that came out. So if you think about the impact of the pandemic as well as the ongoing impact of austerity and things like that, the first step will be providing insight into what young people are experiencing. And there's also some work going on around what should actually be included as a list, what should count as an adverse childhood experience. So early discussions, early kind of co-production processes have indicated that some young people feel that receiving a diagnosis of a long-term health condition or something like autism, ADHD should actually be considered an adverse experience that could kind of impact people's lives. So that's something that we'll be looking at. Actually, is there's an established list of 10 ACEs, are those applicable to the Wales context? And going forward, looking at the interventions, we're hoping to provide, as I said, kind of evidence base for what schools can use. And my background's in education myself, and I know there's a lot of different interventions on talking about trauma-informed environments and things is very common in schools and educational settings at the moment. But hoping to kind of clarify that so schools can go, okay, what is actually going to work, what is worth investing time and staff and things like that into. So hopefully, fingers crossed, there's quite a bit of potential for it to turn into actionable policy or findings that practitioners can take away and use.
Yeah, that's got to be the long-term ambition, right? So fantastic for taking that approach. And I wonder, you're obviously doing a PhD on, looking at it from that perspective, through that lens, if you like. And I wonder if there's any advice that you would give to someone who's thinking of embarking on a PhD, not necessarily in this area more generally, but also potentially to look at these types of questions.
I would say, I think, before you're thinking about if you'd like to do a PhD, think about what are the things that are really important and what do you wish more people knew about, because that was very much my experience of it. So as I mentioned, my background was in education, and very early on, after being a teacher for a couple of years, I was basically astonished to find out how many how much of whether or not a child gets good GCSEs or the grades they get actually has nothing to do with what's going on in the classroom or even the subject being taught. A lot of it is not determined because it's not deterministic, but is influenced by things that are going on outside of school or things that maybe even happened before that child began school. And that was something that really, this would have been about, I did my teacher training in 2015, so going back quite a few years, but I was really just shocked that this wasn't talked about more and more people weren't interested in this. It has become a bit more acknowledged now, but my advice would definitely be to, rather than focusing on I want to do a PhD, I want to get that qualification, think about what are the things that you would like to see change in society and linking it to that. So go back to your interest first as well, because I don't know if I'm best placed to speak about that as I am only in my first year, but doing a PhD is hard work, so I've been told, pretty hard so far. So doing something that you're really passionate about and you can see that long-term gain of what potential it could have on kind of real life and real people is really important and really helpful.
Thanks for listening to this episode of Let's Collaborate from the South West Doctoral Training Partnership. Don't forget to subscribe wherever you listen to your podcast to access earlier and new episodes.